All right, welcome to therapeutic ACE wrapping. On 5 North specifically, we ACE wrap for a multitude of reasons, whether it be edema management, DVT prophylaxis, or to maintain vital stability, as well as for our amputee population. However, before you wrap, you always want to make sure you have an order. Orders are always found in Epic under the Manage Orders tab and the Nursing Communication. It should say ACE wraps or TEDS during the day, knee high. It does not quantify as wrap the patient if it just says SCDs overnight bilaterally. So clarify before you wrap. Some contraindications to edema management. If you have a CHF population, you want to make sure you have definitive medical clearance to avoid cardiac overload, especially for our later stages of their CHF process. Anyone with severe pitting, weeping edema, make sure you have definitive clearance, plus you're doing skin inspections because you could be doing more harm than good with ACE wrapping. And if they're being ruled out for a DVT or you yourself are suspicious of a patient having a DVT, communicate that to your team. If they're already wrapped, take it off immediately or don't put a wrap on it until they're cleared by ultrasound or Doppler. Typically in our PARX, you'll find 4-inch or 6-inch ACE wraps only. I have a preference for the 4-inch ACE wraps for that reason being when you get to the transition between the heel to the ankle, it typically lays a little bit flatter. You want to avoid minimal creasing as well as overlapping to avoid any pressure injuries on the skin. ACE wraps should always be a minimum of 2 per leg. It is very rare that you could wrap a whole leg all the way to the base below the knee with 1 ACE wrap. And for that reason is you want to make sure all that stuff is being pushed up into circulation to monitor that edema and maintain that blood pressure as well. Always starting right below the toes and working your way figure 8 all the way up until that base of the knee. There should always be a 1-inch overlay between the layers of the figure 8 and keeping the same compression all the way through, never pulling for extra compression because that does create a tourniquet effect and you could risk pressure injuries or worse at that point. And now for our amputee ACE wrapping.
Okay, hi guys, how's it going? So in terms of orders, they're usually in the same spot in the nursing communication tab. If you cannot find the orders for ACE wrapping there, you're gonna look in the old paper chart to ensure that the doctor hasn't put it there. Sometimes the doctor will put it in the chart under their dressing orders. Just be careful, there's very few doctors who do not like to use, who like to prefer to do it themselves. So make sure you're checking the orders. They don't like us touching it. There's 2 different sizes of ACE wraps that we use, the 4 and the 6-inch. The 4-inch ACE wraps are typically used for BKAs or short AKAs, and the 6-inch for the AKA. Use your discretion. I typically use a 4-inch for the AKA just because it's easier to manage. But if you're going to do that, make sure you have at least 4 to 5 of the PARX ACE wraps if you're using them. There is also 2 types of ACE wraps. So there's the general that we use from the PARX. This is to be used for all patients who do not use JFK as their preferred vendor for their prosthesis. And then we have a specialty ACE wrap that JFK provides us for all of their patients. The main difference with these is they're extra long, they provide graded compression, and they're multi-use. So the typical process is the PT or OT will distribute these to one of these patients. They will explain the use of it, and if they become soiled, they get washed with soap and water and hung to dry. They never get thrown in the trash. Once the patient shows that they're responsible using these, we'll give them a second one just for use at home. The other main thing to note when you're ACE wrapping patients is to ensure that the PT, OT, and nursing staff are all doing it the same way to provide continuity of care for all of our patients. I'm not going to show the AKA, but the main things to realize is you're going to start from the bottom, work your way up. When you get to the inguinal fold, you're going to go away from the body. And that's just to avoid getting any urine or fecal matter on the ACE wrapping. And once you get beyond the leg, you're going to go up around the trunk and ankle twice. For the specialty ACE wrap, you need to use the silk tape from the PARX. The paper tape and any other type of tape do not stick, and the ACE wrap will fall off. I'm gonna demonstrate a BK A-strap. Again, use your discretion, do it however you like. I'm gonna start a little bit higher than I typically would, but I typically start below the knee. You're gonna come down to the bottom of the residual limb, and then you're going to anchor just below the knee. Next, you're gonna go down to the bottom corners. You're gonna pull tight, and then again to the other side, pull tight, and that's to prevent any dog earring from occurring. And then you're gonna go up and work your way up in a regular figure of 8 pattern, all the way above the knee. We don't want to leave any holes or windows at the knee, and that's to ensure that we're not getting any swelling. You should have a nice honeycomb pattern. And then once you get there, you're going to tape it with the silk tape. And make sure that there's a nice snug fit.